For the audio participants, I would like to let you know that your lines will be placed on the listen-only mode for the duration of today's call. I will now turn the call over to Ms. Wendy Bowen. Ma'am, you may begin.
Thank you. We will begin the presentation shortly. We'd appreciate if you could take just a few moments to answer the polling questions that appear on the screen. Great. Thank you. Let's go ahead and get started. Javon, could you please pull up layout 2? Thank you. Welcome to the fiscal year 2021 National Hypertension Control Initiative Supplemental Funding for Health Centers question and answer session for award recipients. This supplemental funding is commonly referred to by its acronym NHCI-HC, or simply called the Hypertension Supplement. In the first half of this session, we'll provide information to help you implement your awards. The remainder of the time will be devoted to answering your questions. You may submit questions through the Adobe Connect question and answer pod. Questions will not be received through the phone line. You may access the presentation slides on the NHCI-HC Technical Assistance webpage. Additionally, HRSA will make available to award recipients a recording of this session in about 1 week. We will begin with a summary of the hypertension supplement, including an overview of the awards, requirements, and helpful tips for implementation. We'll then provide information on training and technical assistance that will be provided to health centers, along with information on monitoring and oversight of the awards. Then we'll turn to your questions. My name is Wendy Bowen, and I am joined by my colleagues Jennifer Sermis from the Office of Health Center Investment Oversight and Cheryl Thompson from the Office of Quality Improvement. Now I'd like to turn it over to Cheryl Thompson to introduce the National Hypertension Control Initiative.
Thank you, Wendy. Good morning and good afternoon. The COVID-19 pandemic has illuminated and amplified health disparities across the United States. The number of persons living with confounding, uncontrolled chronic conditions, which are associated with higher vulnerability to COVID infections leading to death, is incredible. One such condition is hypertension. Through a unique partnership, both HRSA and the Office of the Assistant Secretary of Health and Human Services Office of Minority Health are now collaborating with the American Heart Association. Through this collaboration, our intention is to assess needs, review workflows, patient protocols, and to develop and deliver right-fitting, evidence-based training and technical assistance to health centers that may benefit from increased support in these areas, and provide support to those health centers that are encountering challenges meeting benchmarks for the management and control of hypertension among their patients. This partnership, now including all of you, is the National Hypertension Control Initiative. Wendy?
Thank you, Cheryl. Now I will provide an overview of the Hypertension Supplement Awards. HRSA awarded nearly $90 million in funding to 496 health centers across the nation and territories. You can access a list of recipients through the NHCI-HC Technical Assistance webpage. With this funding, health centers will increase provider and staff engagement in implementing evidence-based practices, including using advanced self-measured blood pressure, or SMBP technology, to increase the number of adult patients with controlled hypertension. 3-year funding was provided in one award up front. This funding will be used for NHCI-HC activities through the end of your FY 2023 budget period. We awarded the funding this way to give you access to more funds in year 1 to obtain SMBP devices. Health centers must address each of the 4 hypertension supplement requirements. 1, conduct outreach and engage patients with uncontrolled hypertension to participate in the Hypertension Initiative. 2, fully participate in training and technical assistance activities offered in support of the Hypertension Funding Award. 3, ensure access to and support the use of Bluetooth or wireless-enabled SMBP devices for a majority of patients with hypertension and use their data to inform hypertension treatment plans. And 4, collect and share data to support participation in initiative evaluation and reporting activities. You may use funds to support a wide range of in-scope activities to increase blood pressure control in adult patients diagnosed with hypertension, as long as you ensure access to and support the use of Bluetooth or wireless-enabled SMBP devices for a majority of health center patients with hypertension. Ensuring access may include the purchase of devices and/or the use of such devices already available at the health center to be distributed to patients. This might mean a bulk order for such devices in the first year of funding or costs to support a loaner program. Other example uses of funds are personnel, such as health information technology staff, patient educators, quality improvement staff, and enabling staff, training to support patient education on the use of SMBP devices, supplies such as outreach materials and digital platforms and tools to support SMBP, equipment such as servers and EHR upgrades, and health information technology or health IT, including data security and data privacy. Monitoring patients remotely in a patient-centered environment leads to better health outcomes and improved quality of life for the patient. You may have to adapt your existing technology infrastructure to support the collection, analysis, and usability of real-time patient data. The American Heart Association, or AHA, will provide training and technical assistance that is specific to the requirements of the hypertension supplement. Cheryl will talk more about this terrific partnership in just a few minutes. In addition to the support from AHA, there are a number of other currently available resources. Million Hearts 2022 is a national initiative to prevent 1 million heart attacks and strokes within 5 years. It focuses on implementing evidence-based strategies such as SMBP devices to improve Americans' cardiovascular health. The ONC Health IT Playbook provides information on how to safeguard personal health information, incorporate privacy and security into your electronic health records, and perform a risk assessment of your practice. The ONC Patient Engagement Playbook summarizes how to integrate patient-generated health data and use mobile and wireless technologies to promote health. Furthermore, HRSA has several strategic partners that provide national-level training and technical assistance. The High Tech Center offers training on integrating electronic health records and health IT systems. Health Center Control Networks support the improvement of clinical practices by making health information technology easier for patients and providers to use, increasing the security of patient information, and using data to improve patient care. Telehealth Resource Centers support the implementation of telehealth programs with a focus in rural communities. Broadband USA serves local and state governments, industry, and nonprofits in expanding broadband connectivity across America. Their website provides information about local, state, and national level activities that are increasing broadband access. Lastly, the Federal Communications Commission Lifeline Subsidy Program makes voice and data plans more affordable for eligible consumers. Before we move on, please take a moment to answer the question that will appear on the screen to check your understanding of the hypertension supplement requirements. Jovan, could you please pull up layout 3? Great. Thank you. The answer is yes. You must make self-measured blood pressure devices available to a majority, which means more than 50% of patients 18 to 85 years old diagnosed with hypertension. Jovan, could you please toggle back to layout 2? Thank you. Health centers have until the end of the 3 years to make SMBP devices available to the majority of adult patients diagnosed with hypertension. Devices must be Bluetooth or wireless enabled and may be made available through a number of ways, including purchases, loaner programs, insurance companies, or those already on hand, either at your health center or with your patients. HRSA recognizes that not every patient to whom a device is made available will agree to participate. SMBP data are to be electronically transmitted from the patient to the health center. NHCI-HC funds may also support broadband access, such as hotspots, routers, and Wi-Fi enabled devices, and/or supporting enrollment in the Federal Communication Commission's Lifeline Subsidy Program to support the electronic transmission of data. Be sure to document the necessity of such costs. Remember that the following uses of funds are not allowed: costs that are supported by other health center program funds, new construction activities, including additions or expansions, purchase or upgrade of an EHR that is not certified by the Office of the National Coordinator for Health Information Technology, facility or land purchases, purchase or installation of trailers and prefabricated modular units, minor alteration and renovation projects that include work to repair, improve, and/or reconfigure the interior arrangements or other physical characteristics of a location, purchase of mobile units or vehicles to transport patients or health center personnel. I will now turn it over once again to Cheryl Thompson to discuss training and technical assistance.
Thanks, Wendy. As I stated at the top of the presentation, HRSA and the Office of Minority Health have entered into a unique partnership and collaboration with the American Heart Association in order to provide evidence-based training and technical assistance to health centers in support of management and sustained control of hypertension. In addition to HRSA and the Office of Minority Health, there is support that you will be able to tap into and leverage on the community level. For example, faith-based organizations, the YMCA, other private and or nonprofit organizations. On the private and non-federal level, such as your primary care associations and the NHCI-HC, and of course the federal level, partnering with agencies across HHS like the Agency for Healthcare Research and Quality, or AHRQ, and the Center for Disease Control and Prevention Million Hearts Initiative. Both of these agencies continue to develop and apply evidence-based research in the area of hypertension management and control. The Hypertension Initiative neighborhood is large and diverse, and we expect that you will become very familiar with all of the neighbors. Next slide, please. So for 3 years, we will be working together, and during that time, there will be a number of anticipated outcomes, some purely aspirational, others more concrete, measurable, and achievable. Of course, outcomes across health centers will vary, but there are some shared outcomes that reach across all settings. Some of these include those listed on the slide. And those items in bold represent anticipated outcomes directly tied to this initiative. So looking quickly, you might expect that we would want disengaged patients living with hypertension to become more involved in their health care. We would like to see the decrease in blood pressure levels and a decrease in mortality rates for hypertensive heart disease, stroke, ischemic heart disease, and then these two listed in italic and in the lighter text are broader goals or outcomes. We would also like to see, of course, medication adherence to be on the increase and to improve the numbers of health centers with 80% or greater control of hypertension among their patient population. We'd like to see the number of patients screened for hypertension increased. And not long ago, the CDC had a program called Hiding in Plain Sight, where patients were coming into health centers for other conditions but not screened for hypertension. And there was hypertension among those patients. We'd like to see an increase in patient education, knowledge and understanding of hypertension through the social determinants of health lens. And of course, changes around the workflow, treatment protocols, SMBP-based strategies, and patient engagement. And it's all about the patient, so we would like to definitely see an increase in health and digital literacy of the patient. Next slide, please. So how do we get there from here? There is a process. Here we have highlighted 4 major areas of that process. The first column shows evaluation, and evaluation will be ongoing. Assessments, polling, surveying, reporting, categorizing things, all in an effort to better and best understand your individual health center and provide appropriate training and technical assistance. Also, to track and support you in goal development and reaching those goals. The second column, technical assistance, evidence-based best and promising practices provided by the American Heart Association. This might come in many formats: web-based learning, large groups, small groups, specialized one-on-one, and support from federal partners. The third column, partnership development. We just talked about that a little bit. And partnership development will be all supporting clinical efforts as well as patient engagement. And then finally, other activities could come in the form of peer-to-peer engagement, more patient engagement and education, and possibly incentive and award programs. Next slide. So what comes next? Well, following this kickoff meeting, you're naturally going to want to know what to expect next. Very soon, our partner in this initiative, the American Heart Association, will be reaching out to you to gather information about your health centers, staffing, target population, EHR type, whether you have a pharmacy on site, what social services you offer, and more. This is all to get a sense of your individual health center and to decide how you can best be positioned for individual peer-to-peer, group, or other technical assistance. The AHA will be performing readiness assessment. This is more of the survey and polling and live conversations to determine how prepared you are to get started. How soon can you begin to build a relationship with the targeted patients living with uncontrolled hypertension? How soon can you start setup of staffing to meet the programming needs for this initiative? Is your IT ready to go, or do you need support? You can expect to answer these kinds of questions and even more to be sure that you will receive the best fitting technical assistance. AHA will assess any early TA needs you have. Do you know where to purchase bulk Bluetooth or wireless-enabled home monitors? Can you benefit from demonstrations on how to use these monitors and accurately transmit data? Do you have any EHR issues that can be resolved through early TA? Every health center will be expected to develop goals, short and longer term, and those same goals will need to feed up into the larger overarching goals established collectively by HRSA and the Office of Minority Health. So, this all sounds easy, right? I'm joking. Nothing worthwhile and sustainable is easy, but we will be working with you for the next 3 years to make it manageable. So congratulations on your award. I will now turn things back over to Jenny.
Suzanne, can you please pull up layout number 4, please? Please take a moment to answer the polling questions that you see in front of you. Okay, thank you for taking the time to answer those polling questions. Javon, can you please pull up layout number 2, please? Wonderful, thank you. So this part of the presentation will provide you helpful information about post-award monitoring and oversight. Next slide, please. HRSA has an internal specialized oversight team, the Hypertension Initiative Support Team, comprised of project officers that will serve as a primary point of contact for health centers specifically for this funding. This team will review and process post-award submissions that we will further discuss on the next slide. This team will also maintain routine communications with health centers regarding project implementation. The team will work in coordination with the American Heart Association to identify and address any health center technical assistance needs. Next slide, please. Monitoring and oversight will entail the following submissions. In the terms and conditions of your notice of award, you will see the following required post-award submissions. These include possible project and budget conditions, semi-annual progress reports, and annual expenditure report. Awardees with 30-day conditions should have received an email from the Hypertension Initiative email inbox last week. If you need assistance, contact the support team via the Hypertension Initiative email found on the key resources slide of this presentation and on your notice of award. Semi-annual progress reports will cover a 6-month period and will need to include a brief summary of your progress made and any possible barriers encountered. Semi-annual progress reports will be due every July and January throughout your 3-year project period. Semi-annual reporting requirements, instructions will be provided through a future webinar that will be available on demand on the Hypertension Initiative Technical Assistance webpage. The annual expenditure report will be due at the end of your H-80 award budget year through the end of fiscal year 2023. The annual UDS submission will be used to monitor your progress on achieved blood pressure control in your patient population age 18 to 85 who have been diagnosed with hypertension. The Hypertension Initiative training and technical assistance provider may request additional information and progress updates. Health centers that need scope adjustments must submit a change in scope request through the electronic handbook or EHD. Health centers must ensure that their scope of project accurately reflects any changes needed to implement activities supported by the NHCI-HC award. This includes your Form 5A, which lists your services provided, your Form 5B, which lists your service sites, and Form 5C, which lists other activities. Our Hypertension Initiative support team will process change in scope requests related to this funding as needed. It's important to note that if the main point of contact for this Hypertension Initiative award at your health center is different from the project director listed in the notice of award, you must provide the updated contact information to the Hypertension Initiative support inbox. Inbox address is listed on the key resources slide and on your notice of award. Next slide, please. Now we will discuss the terms and conditions that may appear on your notice of award. There are 9 terms placed on these awards. Health centers may receive a project plan condition requesting additional information needed to demonstrate that you will make self-measured blood pressure devices available to a majority, which means over 50% of eligible patients. Eligible patients are 18 to 85 years old diagnosed with hypertension, including controlled and uncontrolled, over the 3-year period. If you change your project plan and that alters the number of self-measured blood pressure devices or SMP devices purchases, you may need to submit a revised budget. In addition, you may see a budget condition placed on your award, which means you will need to submit a revised budget narrative and an SS424A. All conditions must be addressed within 30 days of the award. If you have any questions or concerns regarding your project plan condition, please contact the Hypertension Initiative Funding Support Team using the email inbox in the Key Resources section and listed on your Notice of Award. For any budget condition or fiscal questions, contacts the grant management specialist listed on your NOA. This slide provides key resources for the Hypertension Initiative. Please read your Notice of Award, Terms and Conditions in full. There's a Hypertension Technical Assistance webpage that will be updated regularly. If you have any programmatic questions, contact us using the Hypertension Initiative inbox listed here. When contacting us, please make sure to provide the name of your health center, the award number, and your award number in your email. For any budget condition and business, administration, and fiscal questions, contact the grants management specialist listed on your NOA. Now I'd like to turn the presentation back to Wendy Bowen. Wendy?
Thanks, Jennifer. This concludes our NHCI-HC summary. Now let's turn to your questions. We are joined by Dr. Shannon McDevitt, physician for the Bureau of Primary Healthcare's Expansion Division, the Office of Quality Improvement, the NHCI-HC Funding Support Team, and leadership from the Office of Policy and Program Development will support Shannon in answering your questions. To ask your question, type it into the Q&A pod. When you submit a question, it will be visible to our team, but not to you or other participants on this call. We may combine your questions with related inquiries so that we can answer as many questions as possible today. If we are unable to get to your question today, or if you have more specific questions, we ask that you submit them to the NHCI-HC Funding Support Team at nhci-support@hrsa.gov after today's discussion.
Thanks, Wendy. I'm going to get us started with a few housekeeping questions. First, there's a request that we display slide 9 during our Q&A. I think a few of the participants wanted to get another look at the content on that slide, so if we could go back there. And while we're navigating there, are the slides available?
They are available.
Go ahead, Wendy. You've got this one. That's great.
They are available on the NHCI Technical Assistance webpage.
So for those of you that were looking for a pod to download them from this presentation, we apologize that you don't see them here, but if you go on the Technical Assistance webpage, you will be able to find the slides there. And let's see, I want to turn us now to a couple of questions about devices. What are some examples of SMBP devices? What should we be looking for when we are looking to make purchases?
This is Shannon. I'll take that one. So a self-measuring or monitoring blood pressure device is a sphygmomanometer or blood pressure cuff that is going to be operated with training by your patient, and something that they can use outside of your health center. And for the purposes of this funding, the device should digitally transmit the blood pressure readings to your health center. There are a variety of different models that are available, even as conveniently as Best Buy, a number available online. And as you heard Cheryl outline, you can expect additional technical assistance on selecting the devices that are best for your patient population and your electronic infrastructure. So but you are certainly encouraged to familiarize yourself with a wide range of devices that are available and the quality of the data that they obtain.
Thanks, Shannon. There's also a question about use of monitors that are not Bluetooth or wireless enabled. Can they be part of this project? And if so, would they meet that majority requirement?
The guidance for this award is very specific that the devices must be Bluetooth or wireless enabled. The idea is that we are decreasing barriers to patients actively engaging in their healthcare and in their hypertension treatment plans, and we want to fully leverage the digital capacity and convenience of seamlessly sharing those data between the health center and the patient bidirectionally.
Thanks, Shannon. So while it might be part of a robust plan to address hypertension, it would not serve the purpose of the requirements of the funding opportunity, specifically around the majority of devices. There are a couple of questions about how to define majority, and I know that Wendy covered this in her slides, but I just want to give you a few examples that I saw listed in the Q&A pod so that we can try to provide a bit more guidance. If the health center has 4,000 patients diagnosed with hypertension, would that mean that the health center needs to make the devices available for more than 2,000 patients?
Yes. Your denominator is the number of adults as defined as 18 to 85 years of age, patients diagnosed with hypertension.
And similarly, there are some health centers that receive these awards that have a very large number of hypertensive patients. For example, I saw 37,000 listed in the Q&A pod. Does the same guidance hold for those health centers, Shannon?
Yes, it does.
So majority is greater than 50%. And if you have specific questions, you can feel free to reach out to your project officer. Or, I'm sorry, the special monitoring team. There are questions about loaner programs. If a health center uses a loaner program for the devices, could they loan devices out to about a quarter of their patients diagnosed with hypertension for the first half of the 3 years and then collect those back and do the same thing with another quarter of their patients for the second half of the 3 years in order to meet the requirement?
The requirement allows the full 3-year period to obtain the access to the majority. So yes, that's why the loaner programs can work. At one time, not more than 50% of your patients have to have access to the devices. Over the course of the 3 years of this award, more than 50% of your patients diagnosed with hypertension who are adults need to have access to the devices.
And there's a similar question about gradually making devices available. So is there any requirement for the number that needs to be met in years 1, 2, and 3, or can there just be a gradual increase in availability over the 3 years?
The requirements of this award do not specify, and so a gradual or scaling up of the number of devices is absolutely an acceptable strategy to use.
There were some questions about use of funds in order to meet the requirements. One health center that has a very large number of patients diagnosed with hypertension has noted that the funding does not permit them to purchase individual devices to ensure that they make them available to a majority of their patients diagnosed with hypertension. Are there some recommendations for how they might do this through other means?
We covered briefly in a slide a few ideas, such as leveraging the loaner program model, working with other partners, and that could include insurance providers that work in your area and with your patient population. This will also be a topic of technical assistance that will be provided to you.
Excellent. So that sounds like a good time to ask a few questions about training and technical assistance. There are a lot of individuals in the Q&A pod that are excited to have their names added to lists to make sure that they don't miss out on any important technical assistance for this project. How will grantees be informed of all of the available and required technical assistance opportunities?
I'm going to tell my buddy Cheryl for that help. Cheryl, can you help with the answer to this one?
Can you repeat the question, please? Having technical issues over here.
Olivia, can you pose that question back by Cheryl?
Can you repeat the question again, please?
Oh, of course.
So the question, information about technical systems.
Right. The question is, how will we be made informed of all of the available and required trainings and technical assistance, so people don't want to miss out on opportunities and they know that there is a requirement to participate in the trainings made available through AHA. They just want to make sure that they're automatically going to be on a list to stay informed.
Oh, sure. I'm not sure what kind of list will be made or if there's going to be a portal. All of that you will soon learn from the American Heart Association, and they should be in touch with all of the health centers shortly. We wanted to make sure that we had this Q&A session and kickoff call with you first before the American Heart Association was in contact with you.
Hi there. This is Mark Collins. Just to piggyback on that in terms of how you'll be notified of the trainings, you'll get periodic, there'll be periodic communications from the BIPIC HRSA team regarding global briefings, briefings directly from your project officer. And when I mean your project officer, speaking more specifically regarding the hypertension team that's housed here within BIPIC and all of us are a part of. You will get some of those trainings and invitations to those trainings, noting those that are required and any other tidbits of information regarding technical assistance from that team via the inbox that you've received messages from. So between the AHA as well as our HRSA team, you will be notified and communicated with regarding this funding and the technical assistance very often. Hopefully that answers your question.
That's great, Mark. Thank you. While I have you teed up for Q&A, there is a question just about the timing of training and technical assistance and how that aligns or does not align with the requirement to respond to conditions on the award within 30 days. Do you have any advice for grantees who might be working on condition responses at this time?
Thank you, Olivia. That's a very good question, probably a pretty good-sized elephant in the room. Clearly, there's a need to get everyone on the same page when it comes to coming fully into compliance with your grant, with this particular fund. And that technical assistance, the support that you may need or require to provide guidance, there is some level of technical assistance and support that we can provide as of today. If you submit your question through to the, or your request for support to that NHCI support@hrsa.gov email box. There are some technical assistance services that will, again, need to be stood up and refined before they go live, but a good amount of assistance can be provided as of today. When it comes to your actual condition and that 30-day requirement, we ask that you work with our team via that mailbox to be very specific regarding the kind and level of support you need. Be as explicit as possible in your request. And even if it's a lot and you just rather us give you a call to hear your concerns in detail, that may be the best bet as well. But work with the project officer and the team, and we will get that support to you. We know that 30-day period, I think the number 30 when it comes to the health center program is just, it heightens the level of anxiety tenfold. But I promise you, we are here to support getting those conditions resolved in a timely manner but also in the most thoughtful way. So feel free to reach out to that inbox, and we'll get some support to you right away.
Thanks, Mark. There are a few questions about the work that AHA is conducting. How does this funding overlap with AHA's larger initiative?
Carol, that one might be a good one for you to tackle. I'm not sure if Cheryl's still having some technical challenges. I'll take my best shot. So the larger AHA initiative is to help achieve those Million Heart goals. And so recognizing the vulnerable populations that health centers are specialists in, this combined project between the Office of Minority Health and HRSA to avail these devices to health center patients, we think is going to be an important part to promote equity in obtaining hypertension treatment goals. And so we're really excited about the opportunity to focus on the health center patients and elevate them in the limelight here and part of an important national initiative to which aligns closely with the Million Hearts.
Thanks, Shannon. Back to Mark. There is a question about how to find where to submit condition responses. So Mark, are they listed in EHBs under tasks, or is there another place that health centers should be looking to see if they have any responses that are due for conditions on the award?
Hi, it's a great question. Yes, they should be listed under task, just as the normal avenue for getting communicated the condition, getting them resolved, all the associated tasks. That should be consistent with what. If you have had a condition, it should be consistent with what the process you're used to following. So
great, and just one more conditions question before we talk about
Sure.
a few project implementation questions. One grantee noted that they were requested to update their budget narrative, but not their project plan, and that if they only update one but not both, they will not be consistent any longer. So is it HRSA's preference that they go ahead and submit both revised documents in response to their condition?
Well, yes. It's important that each complement the other. Now, they may only have a budget condition, but by not having them match, they would then be out of compliance with the project plan. So it is important that they update both. And through the communication via EHB and with the team, we can support them and work out the details of the best way to do that. But just in very practical, logical terms, if the budget, the budget plan or the new plan would be in conflict or not accurately reflect, could not be accurately reflected within the project plan, then they would both need to be adjusted.
Thanks, Mark. And again, if you have questions as you're working on any responses that you might need to submit, you can feel free to reach out to the team to get some clarification. I'm going to ask a few implementation questions because health centers are already excited and ready to go and want to make sure that they're implementing in alignment with the requirements. Is it required that the data from the SMBP devices go directly into the EHR, or can it go into an intermediary place where staff actually interface with that data and enter it into the EHR?
We cannot provide that level of specificity in the guidance. So we left the flexibility for your health center to decide what was most feasible considering your health information technology platforms that you currently have available, the financial and staffing capacity to upgrade or enhance your existing platforms to make that transfer of data more streamlined. After receiving some technical assistance, you may find that a more seamless approach where there is no staff interface to transfer the data into the electronic health record is feasible and maybe a good option for you. So a long answer to say that there is no requirement for a touchless transfer of data once it's in the health center building, you could say. However, we do encourage you to take full advantage of the expertise that will be shared by not only the American Heart Association, your technical assistance provider, but also your peers as you participate in various learning opportunities to see exactly what you can do to make remote monitoring fully actualized benefit for your health center and your pursuit of quality healthcare services.
Thanks, Shannon. I think you answered another question that came up several times in your response, but I want to ask it directly just so that everyone is clear. If we need an interface so that the data coming in can go straight into our EHR, can we use this supplemental funding to support acquiring that interface?
Absolutely, yes. Health information technology infrastructure to support the remote patient monitoring and the digital transfer of data is an allowed cost.
Thank you.
This is Vera. I just wanted to add a point on that. If the recipient needs to rebudget to accommodate such costs and it is an item of equipment, they should reach out to their grants management specialist, as that may require rebudgeting or prior approval to do so. If it exceeds $5,000 for that kind of a system or server or whatever the intermediary device would be.
Thanks, Vera. And while I have you on the hot seat, I will ask you another question that I think might be best suited for your team. How does the annual expenditure report differ from the FFR?
This annual expenditure report will focus specifically on line item costs from this award only. So it's going to be way more detailed in terms of what will be submitted, and it's just to record costs that were incurred for the hypertension initiative. The federal financial report is an aggregate report that gives us information on the aggregate expenditures for your entire H80 grant and does not report anything in any kind of detail. So that's the main difference.
Thanks, Vera. This annual expenditure report is something that probably is new to many grantees, so thank you for that clarity. There is an implementation question related to change in scope. So Mark or someone else on your team might be best suited to respond to this. Would we need to request a change in scope to start remote monitoring with our patients if we have not done anything in the remote monitoring space before?
Well, this is Shannon. I can take a stab at this one too.
Okay.
Okay, Mark, you have it?
No, it was going to be a quick no that a change in scope is not needed, but please, if you would, you could provide additional context, or even if your answer, your response is in conflict with mine, you can.
Nope, hardly in conflict. I absolutely agree that remote patient monitoring, very similar to telehealth, is not a service. It is a modality that we use to deliver the services. So hypertension is part of your primary care service that you already deliver. Remote patient monitoring is a tool that you can use to deliver that service.
Excellent. Thank you both. There are a few questions asking for clarity around making devices available, and there was a bullet on one of the slides that said not all patients offered the devices may accept them. I don't have the slide in front of me, so I don't know the exact quote, but can the team just clarify what that bullet means for the health centers as they are planning their projects and tracking on their data?
Certainly. The requirement is that you make the SMBP devices available to more than 50% of your adult patients diagnosed with hypertension. So we recognize that not every patient that you recruit to participate will agree to, and it may take several recruitment opportunities and conversations to bring that patient on board. We encourage you to follow the patients that you think would be appropriate and would benefit for to participate in this particular project, and that because we acknowledge the very human practicality that not everyone will accept this opportunity. We are not penalizing you for those patients that say, no, I've been fully educated about this opportunity. You've given me multiple opportunities or a meaningful opportunity to engage, and I'm still going to say no.
And for the purposes of data tracking, that would count as a health center making a device available. And so there will be more information provided specific to progress reporting as the progress report template and instructions are finalized. But please note that we are looking for health centers to get these devices in use by a majority of their patients diagnosed with hypertension over the 3-year period. We understand that there may be some patients that are really great candidates for this, but ultimately have barriers that prevent them from participating. And so while we're talking about barriers, I'll ask the last question. If a patient that is a great candidate for this device does not have Wi-Fi, so the device will not be able to transmit data back to the health center, are there costs that are allowable to support them in being able to use these devices and have their data transmitted?
If you choose to use these funds for the actual purchase of devices or to make data plans accessible to patients, for example, like a hotspot in one of your sites, then you need to be sure that is allowed, but you need to be sure that you're clearly documenting and maintaining that documentation that explains the necessity of that cost. Another important consideration is that you cannot jeopardize fulfilling the requirements of this award because the funds were used for these types of costs. And so an example would be, well, I couldn't make devices available to the majority of my patients because I bought X thousand phones for my patients, for example. So the 2 points of consideration are that you need to document necessity clearly and keep that in your personal files, and that it cannot jeopardize the successful fulfillment of the requirements of the award. You may have other things to add to that. I just want to check in with you.
No, yeah, that was great. Thank you.
Great, thank you. So this concludes our presentation. We appreciate your feedback and for joining us today. Before you sign off, please respond to the questions that will pop up on your screen. Jovan, could you please pull up layout 5? Your input regarding today's session is very helpful. Again, thank you for joining us, and we hope you have a great rest of your day.